Hi, I'm Professor Richard Neal, Co-Chief Investigator of the NHS-Galleri trial. In this video, I'll be breaking down the results from the landmark NHS-Galleri trial. The trial is the first and only prospective, randomized controlled trial to assess the clinical utility and performance of a multi-cancer early detection or MCED test for population screening in addition to standard care. First, a bit more about the trial, which was conducted in partnership with the National Health Service or NHS in England. The trial recruited over 142,000 participants. It was designed to test whether adding annual MCED testing to routine screening for breast, bowel, cervical and high-risk lung cancer would reduce late-stage cancer diagnoses compared to standard care alone. The primary objective of the NHS-Galleri trial was to show a reduction in combined stage 3 and stage 4 cancers in a pre-specified group of 12 deadly cancers. This was measured by comparing people who received the Galleri test on top of routine screening with those who did not. There was no statistically significant difference in stage 3 and 4 cancers overall in these 12 cancers, meaning the primary endpoint was not met. There were, however, fewer stage 3 and 4 cancers in the intervention group in the second and third round of screening, representing a favourable trend over time. The trial will continue for a further 12 months to better understand these longer-term patterns. When diagnosed at stage 3, a growing number of cancers can be treated with curative intent, as the treatment landscape for stage 3 is rapidly improving. By contrast, most stage 4 cancers are no longer considered to be curable and are managed with palliative intent. In fact, finding a cancer at stage 3 instead of stage 4 doubles your chances of surviving at least 5 years. Data from the NHS-Galleri trial show that stage 4 diagnosis in the 12 pre-specified cancers decreased in the intervention group with each year of sequential screening. We saw a greater than 20% reduction in stage 4 cancers in the second and third screening rounds. This represents a substantial reduction in metastatic disease. These stage 4 reductions were observed in the 12 pre-specified cancers and in all cancer types. Overall, a 16% increase in stage 1 and 2 cancers was observed in the intervention arm after 3 years of screening in the 12 pre-specified cancers. This is important because many of these cancers are typically detected very late. Zooming out, we also asked if adding the Galleri test to routine screening over several years would detect more cancers compared to routine screening alone. The trial found that annual screening with Galleri increased the proportion of cancers diagnosed after screening by fourfold when added to standard of care screening in England for breast, bowel, cervical and high-risk lung cancer. A worst-case scenario for cancer diagnosis is when it is detected clinically through emergency presentations. These cases are associated with substantially higher mortality. The trial found that screening with Galleri decreased the number of clinically detected cancers by 21% and decreased cancers diagnosed as an emergency by 25%, meaning earlier and more controlled entry into care. Finally, Galleri test performance was measured, including positive predictive value, episode sensitivity, specificity, and other metrics. Test performance was consistent with the range previously reported from Grail's North American studies. When someone got a positive test result, they were more likely than not to have cancer diagnosed. Around a third of people who had cancer got a positive result, and false positive rate remains low at below 0.5%. Importantly, no serious safety concerns were reported in participants who received the Galleri test in the NHS-Galleri trial. These results build on past evidence to advance our understanding of cancer detection and biology at scale. When cancer is detected before stage 4, we might have the opportunity to treat with curative intent. The evidence from this trial points to Galleri's potential for population-based health screening benefits.
The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended for individuals who are pregnant, 21 years or younger, or undergoing active cancer treatment. Galleri should be used in addition to routine cancer screening. Galleri does not detect a signal for all cancers. False positive and false negative results do occur.